So we're going to start the Q&A. We had a question come through regarding the 39 hours research, the tipping point, wondering whether that was from a specific research paper or where that could be found, and also whether or not that 39-hour figure was related specifically to construction or all workplaces.
Yeah, that was a piece of work led by Professor Lyndall Strazdins at the Australian National University, and it is published in a research paper. It's a paper that we use a lot to cite because it actually has a really interesting other aspect to it, which I didn't mention in the presentation, which is that tipping point is 39 hours a week for all Australian workers, irrespective of industry, and it's a population study, so it's a representative of the Australian working population, not just construction workers. But there's a gendered aspect to that because the tipping point in that paper is documented as being considerably lower for women, and the reason for that is that women undertake so much additional work, domestic work, caring work, and so on. So that tipping point actually does in fact disguise a hidden issue around long work hours for women and the impacts that has on women's workforce participation and health.
You mentioned the importance of a respectful workplace, and I'll also open it up to Lisa and Heather's opinions on this too. How important in listing all the factors of mental health do you find having a respectful workplace is?
Again, it's absolutely critical. We recently completed a study, which again I didn't mention in the presentation, of construction apprentices. And we've studied the interactions between construction apprentices and between apprentices and their supervisors. And some of the stories and anecdotes that we were told by the apprentices about the experiences that they have and the conflict that they're exposed to, and the even just the use of humour in a really inappropriate way on construction work sites is they're actually quite disturbing. And I think humour is one of those things. The research on humour is very interesting. Humour is a characteristic of most construction workplaces, and when humour is positive and supportive, it can be good. It diffuses stress. It relieves boredom. It can diffuse conflict and tension. But when humour is actually used in an aggressive way, it's actually very bad for mental health. And our study of construction apprentices suggests that in some instances, apprentices are exposed to very damaging humour that can be, sexual innuendo. It can be things which are, accepted as banter in the day-to-day life of a work site, but in fact they can be very harmful. And I think that respectful work environment is really, really important.
Yeah, so I certainly think respectful workplaces are a really important part of the puzzle, but I do think it's important to consider all of your hazards together as well, because they do interact and combine in different ways to increase and change the risks that workers can be exposed to. And one of the really interesting things I think about those kind of harmful behaviours is that not only are they a psychosocial hazard in and of themselves, but they're often also a response to other psychosocial hazards in the work. So if workers are, if you're working 14-hour days and your deliveries didn't come, and you're under all of this pressure and you're not getting enough support, then you're much more likely to take that out on people around you. And that certainly doesn't excuse that behavior. It's always inappropriate, but it's something that you can't look at in isolation.
I was just going to say, don't underestimate the power of language in the workplace, and it's really important. We often teach our mental health champions how to reframe things that they've heard in the work site. So not telling people all the time that the language that they're using is wrong, but when you hear those kind of conversations happen, how you can reframe them in a different way so that people use different language next time.
Next question. With some of the financial challenges that construction companies are facing, do you guys have any tips on engaging with key stakeholders and managers to focus on the mental health of their workers when there's so many other competing factors?
Well, I think the research is quite clear that, for every, I can't remember what the statistic is now, but for every $1 people invest in well-being, I think it's at least $3.50 return. I think the evidence speaks for itself that if organisations invest in people's well-being, they have higher productivity, more efficiency, lots of other business outcomes that by far outweigh what they spend.
Yeah, I think the case for the return on investment's really good, and that's all out there and that stuff, and you can look that up. Another really important thing I think as well is that if you think about these things early at the kind of design stage of the work, you can implement those controls at the design stage, and it's much cheaper than trying to come in and do them later in the piece, and it's going to be much more effective. So when you're starting up projects, it's definitely something to think about. How do you design out the hazards? How do you do it safely? How can you build mental health into the project?
With all the various requirements for managing psychosocial hazards in different jurisdictions around the country, if there is any single comparison document that actually shows them all, or is the best way to sort of get across those to find them all individually and sort of make a list of those yourself?
I'm not aware of a comparison report that's specifically on psychosocial hazards, although I do know that Safe Work Australia periodically publishes a comparison report between the different work health and safety laws in Australia. But until people start implementing their regulations, that obviously won't pick that up. But one thing I would say is that, they all go towards that same primary duty of care. So whichever one you're picking up, I think it's definitely going to help you to manage the risks in your workplace. And most of the differences between them are just about how the stakeholders in that particular jurisdiction would prefer to be communicated with. So they're going to help you do the same thing. And I think they're all really good resources.
Someone has asked, is the Safe Work Method Statement an appropriate document for managing mental health risks, or at least outlining them, or maybe just as a part of a process?
I think it should be part of your broader risk management process. I agree that they could be documented in a Safe Work Method Statement, but I would suggest that it was probably better in your project risk assessment or in your construction health and safety plan, wherever you would normally document your physical risks. That would be the place to put them.
This also to you, Lisa. Does Lang O'Rourke report mental wellbeing and health and wellbeing incidents in the normal places of your safety management system? So the same criteria for classifications, etc.?
So we have just updated our incident reporting system Impact following the work that we've been doing around introducing the psychosocial system requirements. So that's where they will be recorded once the system is updated. So those are some of the changes that we have made with the new standard. Yes.
The question was raised, contractors are often held to account for the entire project. Psychosocial risks aren't always included in the contract expectations. What are your thoughts on maybe that being something that in the future could be built into a head contract?
Certainly, I think in the same way as you do for physical risks, anything that you can do to think about your hazards at the design stage and to eliminate hazards at that first step, I think is a really good approach. And, your PCBU duties, your principal contractor duties, all operate in exactly the same way for psychosocial hazards as they do for physical hazards. The other element as well is that your consultation, coordination and cooperation duties operate in the same way. So if you're, talking to other PCBUs who you work with, that's certainly an important thing to consider.
And I'd just like to add one feature of the construction industry that makes it perhaps a little bit different is that there's a client involved in a lot of the decision making around project timelines and resourcing and cost, and projects are often awarded based on the competitive tendering process. And I think there is actually a real risk. Certainly the interviews we did with those 9 industry leaders back in 2019 highlighted the fact that there's a real risk associated with psychosocial hazards being sort of built into projects very early on through competitive tendering, and what people described as a bit of a race to the bottom, where timelines were typed, possibly even unrealistic in some circumstances, and commitments to those timelines are made by principal contractors who then feed those stresses down the supply networks through to their subcontractors, and contracts often penalize companies for time overruns, and factoring all these characteristics of the structures of the construction industry procurement systems. And I think what you see is a bit of a pressure cooker then emerging in projects, and it's the poor project workers who have to try and get things done to avoid penalties and impacts that might be embedded in commercial arrangements. And so I think there is a structural thing within the industry that clearly, and going to what Heather's just said around actually designing out some of these risks very early on at the tendering stage of projects, I think is a real opportunity.
Next question. Have you guys seen any specific trends in mental health issues arising specifically from workers being away from home? So fly in, fly out situations or working things, and what possibly might be done or could be done in those scenarios to alleviate those issues?
So on the kind of how you could go through alleviating those issues, I think it's very much the same as any risk management process. So it's consulting with your workers, it's identifying those hazards, and then it's working with them and with, you know, your health and safety teams and all of that to work out what you can do to control them. And that will differ a little bit workplace to workplace. But I would always encourage you to start by consulting with your workers as the best first step.
I think one trend, hopefully a positive trend, is that, you know, with all the work that's been done around this now, that I think we're starting to see that more and more people are coming forward to speak out, whether it's about sexual harassment or bullying in the workplace or other psychosocial hazards. I think that there's definitely a rising trend of people being willing to come forward and to talk about those things, which I think is really positive. I thought the parliamentary inquiry into the mining sexual harassment, Enough is Enough. I mean, that was a horrific read for anybody. You know, it was a tragic read. But I think the more psychological safety we can create in the workplace, I'm hoping that we'll see a rising trend of people coming forward and sharing their experiences for the better.
One other question we have here, I think, Heather, this is for you, is possibly expanding on the application of the model code of practice and regulations opposed to the state-based requirements.
Yes,
what the differences are in that.
Yeah, so Safe Work Australia is responsible for the Model Work Health and Safety Framework, and we're a tripartite organisation. So that means that we work with our members, so that's each state and territory and the Commonwealth Work Health and Safety Regulator, and it's also representatives from worker groups at ACTU and employer groups, so that's ACCI and AI Group. And so our model code is agreed by a majority of those members, and it kind of, I guess, reflects a bit of a consensus approach to what we should be doing, and then it's published on the Safe Work Australia website. But each state, territory and the Commonwealth, so each jurisdiction, are responsible for implementing and enforcing their own work health and safety laws. So you will need to talk to your local work health and safety regulator to find out what's in place and what's enforced in their jurisdiction. But all of those materials out there will all provide you with useful information on how to meet your duty and what the expectations are.
Excellent, thank you. We are actually now at the end of our time. We're coming up to the end of the hour. So I'd like to thank all of our presenters today, Helen, Lisa and Heather. We have all of our other webinars up online with a lot of other resources as well. We're keen to hear thoughts of all people in the industry about our webinars. So anything you'd like to see a webinar of in the future, please drop us a line at ofsc@dewr.gov.au with your suggestions and feedback. And a reminder also to follow the OFSC on LinkedIn. It's a great way to stay up to date with all of our latest news, events and data. Thanks again, everyone. See you next time. Cheers.